My name is Carlos Cubas. I work for the New York City Department of Health for the Bureau of Sexually Transmitted Infections, which is also known as BSTI. One of my colleagues is with us. Her name is Joyce Wilson, and I will let her introduce herself. Joyce does some wonderful work all over the city. She has been working for many other programs with DOH, and we are very happy and lucky to have gotten her in our group.
Thanks for that wonderful introduction, Carlos. I am Joyce Wilson. I am from the Bureau of BSTI, and I have been there for the last 26, almost 27 years. I am the current youth liaison for the Bureau. I provide technical assistance.
I see that one of my other colleagues joined us, Liba Franz.
My name is Liba Franz. As Carlos said, I am actually the CBO liaison for Queens.
Like I said, my name is Carlos Cubas. I'm with the New York City Department of Health. We're going to be discussing some sexual health awareness, which includes STIs. And also to let everybody know, a lot of the staff in DOH is activated in an ICS role. Because of COVID-19, they are reaching out to staff for us to do additional work or other work that would be for the emergency response. And for example, my role with the emergency response is as a PHPC Partners Connect liaison. So it's an incredible opportunity for me. I get to work with City Hall on different projects. And a lot of the different staff that works for DOH is at the moment doing not necessarily two jobs, but two different types of responsibilities, which in my opinion, I think it's great for some of us because it gives us an opportunity to reach out and do additional things. So if you hear the term ICS role, that way you know it's for staff that's doing additional work during the emergency response team. The first things are, what are pink parts? And I'm going to give you a brief description of what the I don't want to say medical term, but what the professional term of what pink parts are. So we have here what pink parts are is that they're the mucous membrane lining body cavities and canals that lead to the outside, chiefly the respiratory, digestive, and urogenital tracts. Mucous membranes line many tracts and structures of the body, including the mouth, nose, eyelids, trachea, windpipe, and lungs, stomachs and intestines, and the uterus, urethra, and urinary bladder. So I specifically put that smiley there because when we read that, you know, it's like, what are pink parts? Did anybody really fully understand what pink parts are by reading that? Or if you're seeing the slide, by what that slide is telling you what it is? Because I don't fully understand it. But we're going to dive into it. And I wanted to go over this to show you that sometimes when you go into your doctor's or office for health centers, clinics, they may use words that you don't understand, and that's okay. And the point of this being is that you can ask and say, what are you talking about? What does this mean? What is this? So what pink parts are the areas, the skin in the human body that sexually transmitted infections can be easily transmitted by using bodily fluids. In this image, we have a sample of where the penis, the rectum, and the testicles are. And we're gonna highlight the areas where the pink parts are. So if you're having some kind of sexual contact with other pink parts, like the urethra in the penis or the rectum, these are areas that have pink parts that can transmit sexually transmitted infections or infections in general. There's also the vagina and the anus that have the pink parts area, but that's really everything that the pink parts are. It also includes the throat, the eyelids, the inside the nose, the nostrils. But what we're focusing on are usually the parts that we use when there is sexual contact or intercourse. So this is a closer look of the urethra, the vagina, and we're gonna highlight the vulva because that's the part that people can reach from the outside while they're having sexual intercourse or sexual contact, including the vagina and the cervix. So the rectum and vagina have the highest risk of STI acquisition. And like I mentioned, it's because of the large surface area and the possibility of micro tears and trauma when somebody's having sexual contact. The urethra and the mouth, which is in the throat, have a lower risk, but the risk is still there. So please keep that in mind when you're having this discussion with somebody. So we're going to be discussing a couple of the sexually transmitted infections. What is an STI? So an STI stands for sexually transmitted infection. And STIs are infections that are passed from one person to another person through sexual activity, including vaginal, anal, or oral sex. And earlier on, we showed you some slides on the pink part areas that could pass the infections from one person to another. A long time ago, well, I shouldn't say a long time ago, a little while ago, they used to be called VDs, or venereal diseases. I have never heard them called that, but I know that they exist. I think that one of the clinics used to be called the VD clinic. Leva, Joyce, do you remember when that used to be? No, I'm new to
A very long time ago.
Unfortunately, yes, I do remember. It was in my lifetime.
Would you say that was 10, 15, 20 years ago?
That was well over. That had to be maybe, I would say 40 years ago when it was called the BD Clinic.
Oh, wow. 40 years ago. Okay, so it was a while ago. I wasn't 100% sure. So they are also sometimes called sexually transmitted diseases, the STIs. And we refer to them as STIs now, where they used to be STDs. STDs used to stand for sexually transmitted diseases. And I will open up the floor to Joyce or Leva if you want to explain why we went from STDs to STI.
Essentially, that was done based on the stigma generally associated with the word disease per se. So when you hear disease, you sometimes think of something maybe that it's incurable, or just in general, a negative connotation associated with the word disease. We thought that changing it to say sexually transmitted infections was a little bit softer, not as grim. So that's why we made the change from STDs to STIs.
Excellent. Thank you, Leva. Yes. Because the term STDs, like Leva said, had somewhat negative connotation. You know, people would say, oh, you have a disease. And we know now that sexually transmitted infections can manifest in a person without having any symptoms. So you may have a sexually transmitted infection that doesn't have any symptoms. So that's one of the reasons why it was changed from STDs to STIs. Thank you, Leva. So we're going to be discussing some of the risk factors, and what that means is what are some of the things that could happen or some of the factors that could put you at risk for a sexually transmitted infection. And we have a small list here, which would be unprotected sex, and unprotected sex meaning if you're having condomless sex. There are a variety of different types of condoms and dental dams and finger dumps, which we will discuss briefly a little bit later on today. Also having other STIs or sores. If you have another sexually transmitted infection, which can cause a sore, can lead to the transmission or contact of a sexually transmitted infection. Some medications can also lower your immune system or your inhibitions, depending on how you are, which can put you at risk for sexually transmitted infections. There's also the type and the frequency of sex you have. Because depending on who you ask, sex does not have the same meaning to everybody, which is okay. It's great. You know, we all have a different definition of what sex is. We all have a different definition of what safe sex means also. Safe sex to some people may mean that they have 3 partners and those are the only 3 partners that they have. And that's their method of safe sex. Other people's method of having safe sex is being on PrEP, using condoms, and maybe having a maximum of 10 partners. So we all have different definitions of what safe sex means, and that's okay as long as you know what that definition is, the frequency and the type of sex you're having. Everything is okay. So the number of partners as well. Alcohol and or drug use. If you're using alcohol or any types of substance use, it can affect your judgment. It can affect your inhibition. It can knock you out. And, you know, that's very important for us to keep in mind. We need to understand how our body works. We need to understand how our interactions can work with other people as well. So please keep that in mind. And if you're having a conversation with somebody about this, which I hope you do eventually, remind them that this alcohol and substance use can affect that. So there's also prevalence, and prevalence meaning with how many people with STIs are in somebody's sexual network. So like I mentioned before, some people's definition of sex or safer sex for them could be that they have 3 partners and only 3 partners. And those are the only 3 partners that they have. But if one partner gets a sexually transmitted infection, they can transmit it to the entire group. And then they can pass it back and forth if they don't all have a communication about it and if they don't all get treatment for it. So some of the ways to reduce the risk or the risk factors are, as we mentioned, using condoms and barriers. The New York City sexual health clinics have dozens and hundreds of different types of condoms that we give away for free. You can pick them up. Normally, you could just walk into a clinic and pick up the condoms. We have internal condoms, we have external condoms, we have dental dam. Dental dam is a piece of latex that you can put between you and the other orifice. So if you're going to be having oral sex with an anus or vagina, you can use the dental dam to protect yourself and the other person. There's also oral sex, which is supposed to be less risky. And I say it's supposed to be because, again, it depends on what type of oral sex you're having and if there are other factors like open source or STIs that may expose you to other sexually transmitted infections. And there's mutual monogamy. That's something that we've discussed. If it's just the 2 of you and you're having condom sex, then mutual monogamy should be a way to reduce risk. Or have fewer partners. And if you use substances that are injectables, you can use clean needles. There are clean needle exchanges in New York City where you can take needles that are already used and exchange them for clean needles. Or you can avoid using substances and or alcohol before sex.
I just wanted to add, yes, it is very common among teenagers to basically use alcohol to kind of get into the mood, if you may. However, as adults, we also need to know what our limits are where drugs and alcohol are concerned, because if you don't know your limits, you can fall into those same situations. Why do I say that? I've seen that in the clinics with adults as well. So we're guilty as well. So you have to know what your limits are. So if you know that you're not a person that drinks a lot of wine or drinks a lot of beers or what have you, know what your limits are, because if you take too much, you are definitely apt to go over the limit, and then you'll be just as vulnerable as that teenager.
Yes, thank you, Leva. Yeah, and also people watch us. If you have children living in your household, children, nephews, grandchildren, or whichever, they see everything, they hear everything, and they follow through on what they observe. So it's a very important point, Leva. Yeah, thank you.
It's really any age, because in a lot of nursing homes, there's a lot of STIs that are going around in nursing homes where, you know, who's going with who and things like that. So just because, you know, you're older doesn't mean that STIs are not out there. They're out there. So always like be careful.
Yeah, thank you, Sam. And that's something that a lot of us don't want to think about, but it's true. Nursing homes have, I believe the data from 2017 and 2018, chlamydia and gonorrhea and syphilis had gone up 200% from what I remember in those years. So we're going to jump very quickly into what type of STI testing methods there are, because a lot of people may be afraid of getting tested, because when you think about getting tested for sexually transmitted infection, you think of people putting stuff in you, which they sometimes do, but that depends on what kind of test you're getting. So normally, let's say if you're getting tested for chlamydia or gonorrhea or certain other types of sexually transmitted infections, you would have to pee in a cup. And that's simple enough. They give you a cup, you pee in it, you give it back to them, and then they test that to see if you have been exposed and or have a sexually transmitted infection. They can also swab your throat or your butt. They swab the urethra and the vagina, pap smear. They can also do a type of pap smear, and or they can draw blood. So these are like the different methods. And when I say draw blood, they would just, like, if they're giving you an injection, but they're taking the blood out and then they test that. So I'll give you an example at the sexual health clinics that we have in New York City. When you come in and you tell them you want to get tested for everything, because I overhear that all the time when I'm at the clinic. Clients come in and they just say, I want to get tested for everything, which is great. But the doctors will then ask specifically, the doctors and the nurses will then ask specifically what type of risk factors may have happened, and then they will determine what kind of test they would do. I used to have a doctor about 5 years ago where I would ask him to test me for what, like a client would say, test me for everything. I want to know everything that's going on, my cholesterol, my blood sugar, STIs, everything. I want to get tested for everything. But that's what I assumed he heard when I said, test me for everything. And then then he would tell me, you're fine, everything's great. And then maybe like 3 years passed and I decided to look at my results, and he wasn't testing my cholesterol. He wasn't testing my blood sugar. I just assumed that he was doing that because I said everything. So make sure to talk to your doctor to be very specific on what your needs are. So
Yes, I totally agree with what Carlos said. Just as you go into a store or you go someplace and you know what you want to buy, when you go to your doctor, the approach has to be pretty much the same. You have to know what everything means to you. So if everything means that I want to get tested, let's say for herpes, and you go to an STD clinic, a sexual health clinic, you're not going to be tested for herpes, for example. So your everything may not be everything to the facility that you're going to. So you do have to be specific and know what's available or what they're testing for at that particular site.
Yes, thank you, Leva. Yes. So please keep that in mind. And like I said, if you share this information with somebody, make sure to share that because it's very important. So very briefly, if you have some kind of discharge from the penis or unusual vaginal discharge, or if it's burning when you urinate, that might be some type of infection that you should go to your doctor and mention. We also have intense itching or bleeding. If there are sores on or around the vagina, the penis, or the anus, which are the pink parts that we discussed, definitely discuss this with your doctor. Or if you have stomach cramps that are unrelated to menstrual cycle, also make sure to talk to your doctor about that and get tested. And that's the best way to know, because if you don't know, then you're not going to know. Is that how it goes? If you don't know, you don't know.
The other thing I wanted to bring up also is about sexual toys. Also, STIs can be transmitted through vibrators and things like that. So I just wanted the people to be aware of that.
Yes, definitely. Thank you, Sam. That is a very important point that I was going to discuss a little bit later on with condoms, but let's talk about it now before we jump into STIs, because that falls in place with what we were discussing now. The point that Sam just brought up, that you can transmit a sexually transmitted infection, or you can get a sexually transmitted infection using toys. And when we say toys, we mean anything that you may use for masturbation pleasure for yourself or for your partner or partners. It is always suggested and encouraged that you clean a toy after every use and before sharing it with another person. So I'll give you a specific example of using a dildo. A dildo is a latex or other material used to mimic a penis with the testicles, and that can be used to pleasure yourself or to pleasure another person. But if you're sharing the toys, if going from one orifice to another person, you're sharing the fluids there, the vaginal fluids, the anal fluids. You're sharing any of the fluids that you may be coming in contact with from one person to another. So that's a very important point to keep in mind. So thank you, Sam, for that. So we're going to jump into some of the sexually transmitted infections, and we're going to be discussing some of the top sexually transmitted infections that we see at the sexual health clinics. And one of them is chlamydia. So these are not the only symptoms for any of the STIs that I'm going to mention. These are some of the symptoms from the STIs that we're going to mention. So keep in mind, the main point that we want you to take away from this is that if you don't feel well in general, talk to your doctor. Bring up the issue. Even if it feels somewhat embarrassing, your doctor has heard it. If you don't feel comfortable going to your own private doctor, let us know at the sexual health clinics through our telemedicine number, and because that's all we do. We talk about sexual health all the time, and we will connect you with someone, or we will treat you. So some of the symptoms are with chlamydia is that there may be discharge from the vagina that is different than usual. And when we say discharge from the vagina that is different than usual, we all should know that the vagina has different types of discharge all the time. And that's natural because the vagina is a self-cleaning oven, as they refer to it. And there is discharge often coming from it, depending on your use, depending on your cycle, or just depending on the day. And you know yourself better than anybody else is going to know. So if something feels that's not the norm, then please talk to your doctor. There may be bleeding between periods. There may be discharge from the penis, pain or bleeding during or after sex. There may be pain during urination, constipation, rectal pain, and discharge or bleeding. So make sure that if you feel any of these type of symptoms, that can also apply to chlamydia or gonorrhea, to talk to your doctor. The treatment for chlamydia is antibiotic, and you can take a full treatment of antibiotics and have it clean your system within, I believe it's 5 to 7 days, or within up to 10 days to take the medication to take effect. But you can get treated and you can cure the chlamydia and gonorrhea in your system for the most part, depending on how long you have had it, and also talk to your doctor about that. So you should also be retested after about 3 to 4 months to make sure that you did not get infected again. And remember, I mentioned sexual networks earlier, meaning that if you have more than one partner, or even if you have one partner and the both of you had chlamydia, but you got treated and you go back to your same sexual partner, there's the chance that you will get chlamydia again, or any STI that you may be going back and forth with. So the symptoms in the treatment, in the testing, are similar with gonorrhea. You may have discharge from the vagina that is different than the usual. There may be yellow or green discharge or a drip from the penis. There may be pain or bleeding during or after sex. And the symptoms are similar to gonorrhea. The testing and the treatment are similar. If you do have some kind of discharge, the doctor will swab it or test it to see if you do have gonorrhea or chlamydia, and then they will treat you for it. So an interesting thing with gonorrhea and chlamydia is that if you do have some kind of discharge, the doctors may suggest that they treat you for both, because most of the time when somebody has one, they may have the other, because it's so common that to have one or the other or both. So if the doctor suggests that, that's usually what happens. So don't freak out. Now there's syphilis also. Now syphilis, most people with syphilis do not know they have any symptoms. And, syphilis was something that was brought over a long time ago. And I remember the story that they told me when I was living in Peru. I'm from Peru. And then when I came to the United States, I heard the same story. Apparently syphilis was brought over from Europe to Latin America, and the Latin Americans did not have syphilis in an antibody for syphilis in their system. And it really wiped out a lot of people. There's historical data on that you can read, and there's a lot of other information about syphilis. But syphilis is it's painless. It can cause an open sore, like a canker, and it won't hurt. It would just be there. And that happens at the point of where syphilis went into your system. So it could be on the penis, on the vagina, on the anus, and it can cause an open sore that will not be painful. So make sure that if that's exposed during sex and those areas that we mentioned, that can also be an opening for another sexually transmitted infection to get into your system as well. So it's very important to go to your doctor and talk about it. Because some people say it doesn't hurt, and then it goes away 2 weeks later, then they're like, oh, it's gone. I'm better now. So exactly, Liva. So it's better. Liva shaking her head, and I agree. Just because it's gone or it didn't hurt doesn't mean that something's not going on inside. So make sure to talk to your doctor about it. Syphilis may cause a rash, specifically on the palms of the hands or the soles of the feet. So it may look like a little red dots on your hand or on the soles of your feet. You may have patchy hair loss, fever, swollen lymph glands. The lymph glands are here in the throat area, on your armpits, and in your crotch area. You might have weight loss or muscle aches, fatigue, and these usually go away on their own without any treatment. So like we said, if you do feel like something is not as it should be, make sure to talk to your doctor about it. And they can test you by doing a blood sample and then give you the treatment that you need, which can be, depending on how long you may have had syphilis, to do 1 shot or 2 shots or a couple of shots, depending on it. Yes, Liva.
Well, no, I was saying 1 shot or 3 shots, depending on how long you've had it.
3 shots, yes, thank you. And they're very big shots, I believe. It's like bigger than usual. And they go in like the meaty area, like on your butt. Syphilis can spread if not treated. Yes, excellent point. If you do not treat your syphilis, and like I said, if the symptoms go away, you can still spread it. You can still have it. Eventually in time, and I think it takes a couple of years, but syphilis, Liba, correct me if I'm wrong, but syphilis can attack your nervous system as well.
Correct.
after
It
time,
could
right?
develop into neurosyphilis. You could become blind. You could basically, it could interfere with your musculoskeletal system as well, skeletal system as well. So it's a progressive disease. So the bottom line is with syphilis, you want to make sure that you're getting tested when you go in to get tested for STIs. Why do I stress that? Because oftentimes if you go in and you pee in a cup, you're not going to be tested for syphilis. Syphilis is tested through a blood test, and many people are not aware of that. And many people even shy away from doing the blood test when they come in, but that's the only way to test for syphilis. Women of childbearing age, I just had to throw this in there. If you have syphilis, you could, and you are pregnant, it could be, you can have congenital syphilis, so you can pass that on to your unborn child. Oftentimes when a baby has syphilis in utero, I think roughly about 43% of those births may end in a stillbirth. Okay, so that's critical.
And speaking of congenital syphilis, we've been participating in some meetings for congenital syphilis because the rates are going up in New York City. And it's something that we have not seen in a long time, where maybe 2 or 3 cases of congenital syphilis may happen per year. It has gone up. So as Liva said, please make sure to check that, because if you are of childbearing age, you can pass it on to the child, which can cause blindness, it can cause infection. HIV, a lot of us have heard about HIV. And one of the things about HIV is that we now know a lot of information about HIV. And we're going to be discussing 3 main points about HIV in the next couple of slides. But again, with HIV, similar to what we mentioned before with other sexually transmitted infections, you may not know you have it for a long time. It's not like you will develop 1 or 2 symptoms and you're like, oh, that's what this is. So make sure to go to your doctors if you feel like there's something wrong with your system. And the only way to know if you have HIV or any of these STIs is to go and get tested. So make sure to do that. Now, HPV.
Human papilloma virus.
Thank you. It's a human papilloma virus, and this can cause certain types of cancers. Now, there is a vaccine for HPV, as we refer to it most of the times, and although there is no treatment, there is a vaccine. 9 out of every 10 infections will clear on their own within a year or 2. Sometimes you can develop like these little skin tags, as they refer to them, or warts, depending on where the HPV is. So it can be on the testicles, on the penis, the anus, the vagina, somewhere in the body. So make sure to talk to your doctor about this. Herpes, similar to what we were discussing, is there's prevention for herpes, which can be condoms and dental dams. And like we mentioned, you can get condoms and dental dams at the sexual health clinics. If you do not have a dental dam, you can use a condom. Flavored condom would be best. You can cut it in half and then stretch it out and to use it in order for some prevention. Some of the symptoms for herpes could be painful blisters, sores that scab and then heal without scars, blisters or sores that may be hidden inside the vagina, inside the rectum, or inside the mouth. So during an initial outbreak, you may also experience swollen glands, muscle aches, headache, fever, pain, or difficulty during urination. Now, with herpes, there is treatment and there's prevention, but so far there is no cure, like for syphilis, gonorrhea, or chlamydia. So please make sure to get checked for these and to work with your doctors for treatment. Other curable and treatable sexually transmitted infections. You all may have heard of some of these. There's trichomoniasis, which can refer to as trich, which can cause a foul-smelling discharge from the vagina. It can also cause genital itching or painful urination in women. Men typically have no symptoms, but they do have complications that can include risk of premature delivery for pregnant people. There's also bacterial vaginosis, which can be a pH imbalance. Now, we bring it up during sexually transmitted infections because people may think it's one thing or the other. So we want to make sure that you know the difference, and we want to make sure that you talk to your doctors about it because they're the ones to make the best decision as to what treatment you may need. So this is sometimes referred to as BV, and it's a mild infection in the vagina. And it's not, like I said, it's not considered a sexually transmitted infection or sexually transmitted disease, but there are increased numbers in sexual partners that can cause a pH imbalance, that can cause a bacterial imbalance in the vagina. And there's also crabs, but crabs are a parasitic insect, which we've heard about, which are pubic lice. And they're also known as crabs. And these are small parasites that attach to the skin and the hair near the genitals. And they're not necessarily dangerous, but they're very itchy and they can be very problematic. So make sure to get it treated. In general, also, that's something that we were discussing when we talked about nursing homes also. After somebody may go through menopause, like Liva mentioned and like Stan mentioned, a person may not be concerned about pregnancy, but that doesn't stop other sexually transmitted infections from transmitting from one person to the other just because you went through menopause. So let's keep that in mind also. So earlier we discussed HIV. We're going to talk about prevention and the status of PrEP, and HIV. And what PrEP is, it's a medication. So PrEP, they're using Truvada and another medication, I believe it's called Truvada and Descovy. And there's a third medication that they're working on that they're prescribing people. Now, PrEP is for people who are HIV negative, who do not have HIV. And it's a preventive measure. It's the daily pill that somebody takes in order to prevent HIV from replicating in your body. I drew this image on the right-hand side, which is the blue circle. So just very quickly, the body has antibodies. The antibodies have T cells. And what the T cells are is they prevent infections from happening in your body. So if you are exposed to something, your T cells will come out. There's CD4 cells and there's other type of cells that come out and then they fight the infection and then you feel better. So what PrEP does is that it creates this sort of barrier around it because the T cells have these little, like in my hand, it has like these little receptacles that stick out. So the HIV virus comes into the system and it attaches to the T cell, goes inside it, and then starts multiplying itself. So that's like a very quick overview of how HIV multiplies in your system. And what PrEP does is it stops the virus from connecting into your T cells. So if it cannot connect, it's not going to replicate and the virus will eventually pass through your system. And that's like a very quick overview of what PrEP is. There's a lot more science to that. So there's also PEP, and PEP works in a similar way, but PEP is post-exposure prophylaxis, and that's after exposure, meaning that if you had a sexual partner or if you have some type of sexual intercourse that may have exposed you to the HIV virus, you can go into any emergency room in New York City and let them know, and they will give you 28 days medication of PEP, which is similar medication to PrEP, but it's 3 different types of medication in one. And this will help prevent the virus from replicating inside your system. That way you do not become HIV positive. And then the next thing that we have is U equals U. And what U equals U is undetectable equals untransmittable. And this is a campaign that was started in New York City, I believe, and now it's all over the country and the world. And because scientists found that if a person that is HIV positive can lower their viral load to, I believe it's 200 copies per milliliter or lower for 6 months, then they are considered, their viral load is controlled and they are undetectable. And that means that studies have shown that they cannot transmit HIV to their partner, even if they're having condomless sex. But I wanted to make sure to mention these 3 things to you because these are preventive measures. There's PrEP, which is before preventive measure. There's PEP, which is the after preventive measure. And then there's U equals U, which is if you can keep your viral load in the undetectable level, then you can be untransmittable. And that's within 6 months or more. Just because you are undetectable, meaning that you lower your viral load, does not mean that you are protecting yourself or others from other sexually transmitted infections. So if a person is HIV positive, but their viral load is 200 or lower, and they're considered undetectable, if they have gonorrhea or chlamydia, they can still transmit gonorrhea and chlamydia. Or if they have unprotected sex with someone that has gonorrhea, chlamydia, herpes, or whichever, then they make themselves vulnerable to that.
And being virally suppressed and the whole concept of U equals U only applies to sexual transmission of the virus. So it doesn't, for example, apply to a woman that may be considering breastfeeding or something along those lines. Hasn't been tested.
The condoms that we have on this slide, most of them, if not all of them, can be picked up at the sexual health clinics, which I'm going to discuss now. The sexual health clinics are working in a reduced services, meaning that the walk-in services that we have now are very limited, and they're also limited of how many patients they can see a day. Whereas in the past, we used to see 80 to 100 people a day per clinic. Now we can only see a handful of patients that can walk into the clinics. So please make sure to always use our telemedicine number, which we have displayed here. You can call them up, speak to a doctor or a nurse. They can diagnose you and they can make suggestions. If you need to see somebody, they can schedule you an appointment so you can come to one of our clinics or to one of our partner sites. Some of the emergency services that we're offering are PEP, which is the HIV post-exposure prophylaxis, emergency contraception at some clinics with a limited amount of number per clinic. So please make sure to call in before that. There's HIV treatment initiation for those diagnosed with HIV who would like to start HIV treatment for the first time. There's urgent follow-up for patients who were contacted by the clinic staff. So if you got a phone call from one of our staff saying, hey, we talked 3 months ago about XYZ, please come into the clinic. Please make sure to follow up on your appointment or reschedule or see what works for you. We're also offering IUDs and implants, and they're available by appointment only. And to schedule, you need to call the New York City Sexual Health Line telemedicine number, which we have here. It's 347-396-7959. And you can call that telemedicine number, which will connect you to a nurse, a resident nurse, a doctor, or somebody that'll do the intake at our sexual health clinics, and you can discuss your sexual reproductive health with them, and they can make an appointment for you. Now, we are seeing teens and young adults, 21 years or younger, and they can receive HIV and STI testing at the clinics in walk-in services. But we also have a provider directory, which we will send the link to you, where you can look for locations near you that are seeing people. What the provider directory is additional organizations like Community Healthcare Network, the Osborne Association Center, etc., that are offering services. So, and we have about 140 providers that we update at least once a month to make sure that they're offering these services to you. So please double check the provider directory. You can also ask for that when you call our sexual health hotline or telemedicine hotline, and they will connect you with somebody there. So there's the telemedicine number again, and we are operating Monday to Friday, 9 a.m. to 3:30 for the telemedicine number. This is some of the information for the telemedicine number. For faster service, you can speak to us. For a care provider, to telemedicine services related to signs or symptoms of STI or HIV, exposure to an STI or HIV, HIV treatment initiation for those diagnosed with HIV who would like to start HIV treatment for the first time, emergency contraception, and consultation for long-acting reversible contraception, IUD, and implant. One more thing that I want to mention is which clinics are open, which clinics are closed. And here's a list, Monday through Friday, 8:30 to noon, and then again from 1 to 3:30 p.m. So keep in mind, the sexual health clinics, all of them are closed between noon and 1 p.m. So if you go in at 12:30, they'll let you inside, or they may make you wait online, but expect a small wait time while they're closed between noon and 1. So it's the Chelsea Sexual Health Clinic is open, Fort Greene Sexual Health Clinic, Jamaica Sexual Health Clinic, and Morrisania. All 4 of them are open. Some of them are open with limited days, but if you need to go to one of our clinics, please make sure to call the telemedicine number and just double check before you go in. That way you don't go in and find out that the clinic is closed or they don't have any more spots to see somebody. So please call it. The clinics that are closed are Crown Heights, Central Harlem, Riverside, and Corona. And although they are closed for sexual reproductive health, all of our sexual health clinics now have COVID-19 express testing, which is great. And if you do need to get tested and one of these clinics are near you, you can reach out to the sexual health clinics, or you can go. That's a walk-in basis. You come in, you wait online, and then they test you. And lastly, there's a slide that I always like to share And this is for everybody. This is for staff. This is for friends, for loved ones, for participants, for everybody. This is for me. This is for you. We are offering Thrive NYC and NYCwell, which is peer support. And you can call them 24 hours a day, 7 days a week. You can call them on the phone. You can text them on your phone. You can chat them on the computer. Any way that you feel more comfortable, you can reach out to somebody at this program, and you will talk to a peer support person, which will give you counseling or some type of counseling, advice, or help. So say if you're having a difficult time, you're going through difficulties with yourself, your family, your friends, your neighborhood, anything that's going on, anything that's in your mind, please reach out. It is okay. It's always okay to say, I need help. And New York City offers this great service for everybody. They speak hundreds of different languages. I believe they have 200 plus languages. They also have a specific number for the deaf or hard of hearing. They have that information as well. If you don't feel you need this information, please share it with friends and family or anybody that you know. It's a great service, and it's a free service, and it's a 24-hour day, 7 days a week service. So please keep this one in mind as well.